Welcome to The Explainer. Today we are going to completely flip the script on how you think about joint pain. For decades, we've kind of treated our bodies like machines and our joints like mechanical hardware. We've been told that as we get older, our joints just simply wear out. But what if I told you that's actually fundamentally wrong? Today we're taking a really deep dive into osteoarthritis. We're going to unravel the biology, look at how the breakdown actually happens, and most importantly, dig into the evidence-based strategies you can use to take back control of your mobility. 500 million. I just want to let that number sink in for a second. That is the number of people globally who are living with osteoarthritis right now. It is literally the most common form of arthritis on the planet. But honestly, despite how widespread it is, it's incredibly misunderstood. We're not just talking about a few achy knees or stiff fingers here. It's a massive global health challenge that impacts daily life, independence, and overall well-being. So we really need to understand exactly what it is we're dealing with. So here is our roadmap for today's explainer. We'll start with the anatomy of a joint, then look at what happens when joints break down. Next, we'll cover the triggers and warning signs, move into evidence-based treatment, and finally, wrap up with a path to prevention.
All right, let's jump right into section 1, anatomy of a joint, more than just a hinge.
First things first, we need to completely bust that old wear and tear myth. Osteoarthritis is a chronic degenerative joint disease that affects the entire joint. It's not just about your cartilage rubbing away like a brake pad on a car. It's actually a highly complex condition driven by mechanical stress, low-grade inflammation, and get this, actual remodeling of the bone underneath. So it's a very active disease process, not just passive aging. To really understand the disease, we first have to understand the healthy joint ecosystem. And it really is an ecosystem. A joint isn't just two bones meeting. You've got articular cartilage providing this beautifully smooth, frictionless shock absorption. You have the synovial membrane producing fluid that literally feeds and lubricates the joint. You have menisci, especially in the knee, acting as load distributors. And crucially, wrapping around all of this, you have the ligaments, tendons, and surrounding muscles providing vital stabilization. When this whole ecosystem is in perfect harmony, you get smooth, totally pain-free movement. Which brings us to section 2, when joints break down, the cascade of failure. This disease, it doesn't just happen overnight. It's really a progressive cascade, almost like a line of dominoes falling. Step 1, that smooth articular cartilage we talked about, begins to soften and gradually wear away. Because of this, in step 2, the actual physical space in the joint narrows. Step 3 is fascinating but painful. It's where the body tries to repair itself, but kind of gets it wrong. The bone underneath thickens, and painful bone spurs called osteophytes start to develop. Step 4 brings in that synovial inflammation and muscle weakening. And finally, step 5, the culmination of this whole cascade, results in pain, stiffness, and a real loss of function. So how do doctors actually track this? Clinically, they measure this progression using the Kellgren-Lawrence grading system, which scales from grade 0 all the way to grade 4. And what's great about this is it maps exactly what a doctor sees on an x-ray directly to what you, the patient, actually feel. For example, at grade 1, you might just have a tiny bit of bone spur formation with absolutely zero pain. But by grade 4, the joint space is severely narrowed, cartilage is extensively degraded, and the clinical correlation there is chronic pain, joint deformity, and significantly reduced mobility. Now, I also want to draw a really clear line in the sand here, because osteoarthritis is constantly confused with rheumatoid arthritis, but they are fundamentally different beasts. Osteoarthritis is primarily mechanical and involves low-grade inflammation that's very localized to the specific joint that's under stress. Rheumatoid arthritis, on the other hand, is a systemic, autoimmune condition. That's where the body's own immune system is actively attacking its joint linings. Understanding this difference is absolutely critical for making sure patients get the right treatment. Okay, moving right along to section 3, triggers and warning signs, listening to your body. So what actually sets this cascade off? Well, while being over 50 is certainly a factor, and being female, particularly after menopause, does increase your risk, those aren't things we can change. The really actionable risk factors are obesity, previous joint injuries like an old ACL tear, and repetitive occupational stress. And hey, notice muscle weakness sitting right there at the bottom of the list? Remember our joint ecosystem from earlier? If those stabilizing muscles are weak, the mechanical stress on the joint itself increases dramatically, which just accelerates that cartilage breakdown. If you're wondering what the early warning signs actually feel like, you really want to pay attention to the gelling phenomenon. It's a classic hallmark of osteoarthritis. It's that profound stiffness you feel right when you wake up, or maybe after sitting on the couch for a long time. It feels almost like your joints have turned to jelly that has literally set in place.
The key diagnostic indicator here, though, is that this morning stiffness typically resolves in less than 30 minutes once you get up and start moving around.
Let's pivot to the solutions in Section 4, evidence-based treatment, taking back control.
When we look at the international guidelines from the WHO, the American College of Rheumatology, and the big physical therapy associations, they all completely align on these first-line treatments. Notice what's not here. It's not an immediate leap to heavy medication or surgery. It starts with education and weight loss to actively reduce the mechanical load on the joint. It prioritizes targeted physiotherapy, specifically strengthening the quadriceps and core to stabilize everything. And we also see range of motion exercises and localized pain management, like topical NSAIDs, playing a massive, massive role.
It's super vital to view treatment as a progression. Conservative treatments, all those daily management strategies we just talked about, are always the starting point, and honestly, they're highly effective for a lot of people. Surgical interventions, like getting a total knee or hip replacement, those are massive, life-altering procedures. While they are highly successful, the medical consensus is crystal clear. Surgery is strictly reserved for when these conservative, non-invasive methods just no longer provide adequate symptom relief and your quality of life is severely impacted. And that leads us perfectly into our final section, Section 5, the path to prevention, building resilience. Okay, we have to tackle the single most common and frankly paralyzing question patients have when they receive an osteoarthritis diagnosis. They think, if my joints are breaking down from mechanical stress, won't walking, lifting, and exercising just grind them away even faster? It is a totally logical fear. But the definitive answer is absolutely not. In fact, exercise remains the absolute cornerstone of treatment. Remember how we talked about the synovial fluid feeding the cartilage? Well, movement physically pumps that nutritious fluid right into the cartilage. Motion is quite literally lotion for your joints. Far from destroying the joint, evidence-based physical therapy builds up the surrounding muscles, unloads the joint itself, and has been proven time and time again to significantly delay the need for surgery.
So let's assemble your everyday prevention toolkit based on these guidelines. Maintaining a healthy weight removes an exponential amount of stress from your knees and hips. Regular muscle strengthening builds your joints' natural shock absorbers. Do not underestimate the power of proper footwear and workplace ergonomics to make sure your body's alignment is correct. And above all else, avoid prolonged inactivity. You've got to keep that joint ecosystem moving and nourished.
I want to leave you today with this really powerful quote directly from the medical literature. Osteoarthritis does not mean the end of an active life. With an early diagnosis, targeted movement, and a real commitment to evidence-based care, you have incredible power to protect your joints. So, the real question isn't whether your joints will age. It's what steps you're going to take today to ensure they carry you strongly into tomorrow. Thanks so much for joining me on this explainer, and I'll see you next time.